Hi everyone, Emily here. We are 5 minutes away from starting this week's The Art of Senior Fitness Program Design, episode 19. Oh my gosh, we've been going at this for quite a while now. I'm gonna make sure we are live on all of our platforms. Let's see here. I think we are live on LinkedIn. Let's see about Facebook. Hope everyone's having a good Friday. The weather is starting to get nice and warm here in Calgary. I'm really starting to enjoy it. Having a nice spring. Let's see. Oh, and there's Facebook as well. Good. All right. Wonderful. So joining early because I wasn't with you guys last week, took a week off, but really excited about the topic for this week. So if you just got the alert, Emily Johnson or Stronger You Senior Fitness was live and you're wondering, what is this? Well, the Art of Senior Fitness Program Design is a weekly series that I've been doing where we talk about all aspects of senior fitness programming. So if you're a fitness instructor or you work in recreation, or if you support someone who works in fitness or recreation, then you're definitely going to want to stick around for the next 30 minutes. Feel free to grab your lunch if you're out east, go grab a coffee if you're with me out west, and we're going to get into it in just about 4 minutes. So you got a couple minutes to get yourself all set up while I make sure everything is going well here. I think we're still live, looks good, and still good over here. Awesome. So for those of you who have already joined, welcome. And don't forget, during today's talk, if you want to let me know your experiences on the topic or you have any questions, I can just talk a mile a minute, but I will pause every once in a while. When someone asks a question on Facebook, it pops right up for me. When someone asks a question on LinkedIn, I'll kind of refer over here to my screen here, and I'll just read out your question or your comment for the other platform so they can hear what's going on as well. And if you can't stick around for the next 30 minutes, that's okay. You can watch the replays on the Stronger You Senior Fitness Facebook or LinkedIn pages, and also on our YouTube channel. So all 19 episodes are available for you there. Please feel free, go take a look. And if you enjoyed today's webinar, please share it on your favorite social media channels. And I would be really grateful if you could do that. All right, so still just 2 minutes away. If you're just joining us, this is the Art of Senior Fitness Program Design. My name is Emily Johnson. I'm the founder and creative director of Stronger You Senior Fitness. And I've been doing this series 19 times now to try to give you some tips and tricks and strategies to run exceptional senior fitness programs. You can become a Stronger You Senior Fitness instructor. You can learn more about that at strongeryouSeniorFitness.com. But if that's not an option to you right now, then I'd love if you could join me every Friday and you can hear a lot of the tips and tricks that I can share with you. So we just have about 1-2 more minutes before we officially get started. Grab your lunch, grab your coffee, whatever it might be, and we'll get started soon. Let me make sure I can see the questions on LinkedIn here. Good. Alrighty. It's Friday and I love this topic. What a good day. I hope everyone's doing well out there. Feel free to say hi if you're joining us as well. And if you want to let the group know what you do, so we can get a sense of who's here. And we'll get started in just a minute. All right, I see a couple more people joining. So once again, if you are just joining, this is the Art of Senior Fitness Program Design. As soon as it turns 10 o'clock my time, 12 Eastern and 9 Pacific, we're going to jump right into it. And we're going to talk about group fitness and chronic disease today. This is a topic I love, so I'll hold off. I'll wait till it's exactly start time before I get into my experience with individuals with chronic disease. So welcome for anyone who's just joining. We're going to spend the next 30 minutes together, and it's going to be a great 30 minutes, that's for sure. All right, so it is exactly 10 o'clock Mountain, 12 Eastern, 9 Pacific on the dot. So we're going to get started. So welcome everyone. This is the Art of Senior Fitness Program Design. And my name is Emily Johnson. I'm the founder and creative director of Stronger You Senior Fitness. We do this together every Friday on tips, tricks, and strategies for you to have an exceptional senior fitness program. please feel free, ask questions along the way, share your experiences. I'd love to hear your perspective on these topics as well. So we're going to talk about group fitness and chronic disease today. And this is working with individuals with chronic disease was my first introduction into working with older adults. You may have heard me say this story before, but when I was in university, I actually wanted to be a dentist. And I went into my kinesiology program because I was a dancer and I thought that'll be a really interesting 4 years. And then I'll still take all the boring bios and chems in order to become a dentist. And it was in my first year of university that I started volunteering at a cardiac rehab program, which later became a chronic disease management program. And I ended up later becoming an employee and working for that program that I volunteered for. And this is where I was introduced to working with older adults and hearing their stories and just learning all about this amazing population. And 10 plus years later, the rest is history. You can't tear me away from them, that's for sure. So really excited today for us to be talking about this topic. So first stat I want to tell you is 75 to 80% of older adults report having one or more chronic diseases. So that's pretty big. We're going to go through what those specific chronic diseases are, but 75 to 80%. So chances are, if you're an older adult fitness instructor or you work in recreation or you work with older adults, you're going to have a lot of chronic diseases in your program, or within your class rather. So this is something that if you haven't really thought or done much education on, you definitely want to, today can be kind of the tip of the iceberg for you, and you can start doing that continuing education in order to familiarize yourselves with these chronic conditions. So these are 10 of the most common chronic diseases. So heart disease, stroke, cancer, asthma, chronic obstructive pulmonary disease, also known as COPD, you probably hear that a lot, diabetes, arthritis, Alzheimer's disease, and other dementias, mood disorders, and anxiety disorders. So if you think about your class, kind of scary, a little bit unnerving to think that within a class of 10 or 20 people, I know we're not doing that right now, but when we are one day able to go back to these large class sizes, 70 to 80% of your class, so 16 out of the 20 in a large group that you might have could have one of these chronic diseases. So what do you need to know about ensuring that you're doing the right thing to help them increase or maintain their current level of fitness? Now, these are incidents of multiple chronic conditions. So if it wasn't scary enough that you might have one of those 10 in your class, very likely if you look at the column all the way over, I guess that would be your right maybe, with the 71 and over, it's over 80% who have up to 3 multiple chronic conditions. So now you have to worry not only about one, but multiple chronic conditions and how they interact with one another, okay? Now, what are the key components to consider? So we're going to go through each of those 10, but there's a couple things that you really need to consider for any chronic condition. So that's the good news. It's not like you have to be an expert in 10 different chronic conditions. As long as you typically follow these guidelines, you're going to do things that are safe and effective for these groups. So number 1, have them speak to their doctor. And when you have, when you're working, excuse me, when you're working with older adults, we typically will do a PARQX form, and part of that form does usually have them go see their doctor and let them know that they're starting a new fitness regimen. So I would have you recommend them to go speak to their doctor and let them know let them know that they are going to be coming to your fitness class. And as a result, their doctor is then going to tell them what are the safe ranges and what do they have to be worried about with their medications. Excuse me, I'm losing my voice today. It's not a good start. All right. So you don't necessarily need to be the one who knows the ranges for things like blood sugar or their blood pressure, things like that, heart rate. You don't need to know their medications. That would be likely outside of your scope, but you want them to be aware. And if they can, if you're in a senior living setting and your health and wellness individual manager knows that, then that's really great as well. Working with individuals with chronic disease, it becomes even more important for the warm up and the cool down. Okay, I could talk about this all day, but in some classes we're not doing correct warm-ups and correct cool downs. So just a reminder, a warm-up is going to be 5 to 10 minutes. It's going to be large rhythmic movements. We're going to be warming up all the joints, and you can only see a little slice of me so you can see the slides, but things like marching, getting the shoulders working, starting to get mobility in the spine, in the neck. So too often I see a class start with just stretching, and we need to do something to warm the body and to gradually increase that intensity, especially when you start to work with individuals with heart conditions and a whole host of other chronic conditions. The warm-up becomes so important. And then on the way down as well, gradually decreasing that intensity as well. So you're getting that gradual cool down. You're not just ending the class and they're just sitting down, and then we can get things like blood pooling and drops in blood pressure and all sorts of things that we don't want. And then when you have an individual starting exercise, they should start slowly. Start somewhere comfortable, and then they're going to gradually increase from there. We would want as best as possible that an individual not just join maybe a moderate to advanced class in the middle of the class. It's been working together for months and months and months, and try to get up to their level. Everyone's going to be at their own spot in their fitness journey, and with chronic conditions, it's more and more important that they do go at their own pace and they improve or progress as they feel that they're able to. And this might surprise you. We're going to talk about this more per each chronic condition, but with most chronic conditions, you are still aiming for Canada's physical activity guidelines. We're going to talk about cancer next. So most people would not realize that someone who currently has cancer typically should be trying to still reach Canada's physical activity guidelines. So that's an important point that we'll continue to talk about. And then definitely checking in with your participants. Throughout the class, you want to make sure you're saying, hey, Mary, you're brand new today. How are you feeling? How's the class going? And you're checking in, where do you feel you're at on a scale from 1 to 10? These are really, really important for individuals with chronic conditions. Water, just like I had here, before, before, during, and after. I always have my water whenever I'm teaching. I'll drink it at the beginning, I'll drink it while I'm teaching, between tracks, I'll drink it at the end. I always usually hand out a glass of water to all of my participants. And even some who say, oh no, that's okay, I said, no, really, you should try to just have a few sips during the class, at minimum. And then for me, I'll always kind of lean down during the class and grab my water, take a sip, and it signals to them to take a sip as well. And then knowing when to stop. So you should educate your participants on this, and you should know the signs as well. So if someone's looking really unusually pale or sweaty, nauseous, if they are short of breath, if they have any chest pain whatsoever, they need to stop, slow it down, take a break. And then even at that point, that might be where if you're in senior living, you can call over a nurse, or if you're out in the community, then maybe you're going to bring over someone if it's gone to that level, an ambulance or whatever it might be. Very good. All right, so I mentioned we're going to talk about cancer. So over 200,000 cases each year. It is the leading cause of death for Canadians, 25%. But we have over 1.7 million individuals, cancer survivors, living in Canada. So that is good news. That's a silver lining. And actually, there's becoming a lot of research showing that physical activity can be really a good thing to help while individuals have cancer. So some of the studies, I won't cite the actual studies here, I've just kind of pulled from the different studies that I've seen, but we've had studies where using, I believe it was, they had a control group who did no exercise. There was then a group who did strength training, and then a group who did aerobic exercise. And typically they're done about 3 sessions per week. the two groups, the aerobic group and the strength group, were able to complete more of their chemotherapy treatment than the group who didn't exercise. And actually the strength training group was able to complete the most amount of their chemotherapy. So oftentimes having a good outcome when you've been diagnosed with cancer and you're doing chemotherapy is being able to tolerate and complete as much of that chemotherapy as possible to get the best outcomes. So anything that can help you get to the end of your treatment, if it's exercise, is really, really going to be helpful. Also, we found that it was, or not me, the researchers found that you can actually increase the effects of the treatment. So not only did they be able to finish more of the treatment, but the treatment was more effective. So that's a really cool outcome. And then when the researchers followed up with those individuals at 8 years later, so year 7, year 8 for individuals with cancer is really important, because if you can make it to year 7 or year 8, that kind of means that you've really been in remission. That you're truly in remission, and the chances of the cancer come back are now at a lower rate. So that's really great. And what they found is for the disease-free survival at the 8-year period, those who took part in the fitness while they were doing their chemotherapy were more likely to still be around, which is the whole point, right? Now, I mentioned we're going to be always trying to get Canada's physical activity guidelines. We're going to try to reach those guidelines. So 150 minutes of moderate to vigorous intensity aerobic activity, 2 days a week of muscle and bone strengthening, and then balance and flexibility. So the only difference with individuals doing chemotherapy is you're going to be more around that moderate intensity, and it really is going to depend on the person and their interactions to their treatments to be how much they're able to really do. So great. All right, wonderful. So thank you, Pam. Thank you, Kevin, for your comments. Just checking on Facebook. Good, everyone's doing great. Feel free, share your experiences, ask me questions as we go. I'll try to look down at my different devices here every once in a while. Next, heart disease and failure. So this is the second leading cause of death in Canada, and over 20% of older adults have some sort of heart disease or have heart failure. And so we typically, with individuals with heart failure, we have 4 classifications. So the first classification would be individuals who can do activities of daily living with really no issue. Class 2 is they have some degree of difficulty. Moderate for class number 3. And then class 4 is they do have difficulty, or they cannot do activities of daily living due to their heart failure. So typically, I would say if you're just I won't say just, if you are a fitness instructor working in the community, working in senior living, most times you're going to be working with individuals in class 1 and 2, maybe class 3. More at that point, we see individuals doing specialized cardiac rehab or cardiac fitness programs with hospitals and things. So generally speaking, if you follow these guidelines, you're going to help to keep those individuals safe. So when we're trying to get to a moderate to a vigorous intensity, which is sort of our everyday healthy older adult, we want them to go to an intensity where they can talk, they might be breathy, but they can't sing. With individuals with heart disease and heart failure, we want them to walk so you can talk. So they're going to be generally about a 4 to a 6 on a scale from 1 to 10. So again, just like with the individual with cancer, individuals with heart disease and heart failure are going to be around more of that moderate intensity, but they're still trying to achieve Canada's physical activity guidelines. Okay, no more are the days where if you've got cancer or heart failure or any of the other ones we're going to talk about, should your doctor be saying take it easy. Okay, we don't want to take it easy. The research is telling us that if we do engage our bodies and engage in physical fitness, we are going to help all of these conditions where previously we may have thought, wow, you probably shouldn't be exercising if you have cancer or heart failure. And just a note on heart failure, I had a wonderful woman who I used to work with. She always told me, oh, Emily, carpe diem. And, people told me probably, I think it was 3 times that she had 6 months to live. And she just kept going. And I swear she was seizing every day. She was coming to fitness 3 to 5 times a week. And so I just love stories like that where someone who has a diagnosis like heart failure is not letting, is not getting in the way of their quality of life necessarily. So that's really great. And last but not least, watch out for fatigue or unexpected weight gain. So again, I'm not expecting you all to, be doctors or to, check blood pressure or anything like that. Please don't do anything that's outside of your scope. But if you notice someone who is gaining a little bit of weight, there's a little trick about the sock line. If you look down at their sock line and they've got this swelling, they're holding water, that is something to be concerned about if they've got this increase in weight. So, knowing a little fact like that can help you to just say, hey, maybe you should just see your doctor. You might be overdoing it just a little bit. Okay, I'm gonna pause. I think I see a couple questions here. Wonderful. Hello, John. Very good. Oh, I can't see the rest of it here. Are you using heart rate monitors or perceived exertion? Yeah, great question, John. Typically, we'd probably see people just using the ratings of perceived exertion. And typically, the research has shown that heart rate and rating of perceived exertion matches quite well, actually. So the research is showing that that can be quite effective. If they have heart rate monitors, that might be in more of a cardiac rehab setting, then that's going to be great, and they can ensure they're staying within those ranges. But typically, you say, hey, are you feeling around a 4 to a 6? Then they should be okay. I also want to make mention too, so John's kind of just given me another thought as well around heart rate, is individuals with beta blockers. So if they're taking a beta blocker, they might not be able to get, so their heart rate is not going to go above a certain rate. So what happens at that point is if they keep exercising above that, above a higher intensity, their heart is not going to be able to keep up with it. And what will happen is they're going to start to feel really fatigued, and the blood is not going to, and the nutrients is not going to be able to get to the muscles the way it needs to. So that's something to watch out for as well with individuals taking different kinds of medications. And this goes back to that initial recommendation of making sure they speak with their doctor on what they are safe to do. Does the doctor recommend for their condition that they can do moderate to vigorous, or is it moderate, or should they start start at a lower intensity? And as well to note, for people with heart failure, research is showing most of them only get around 3,000 steps per day. So that's not very much at all. And we would try to help those individuals gradually progress to around 7,000 steps per day is what the research is showing. So again, they have to start where they're at. We got to meet them where they're at, and then we have to progress it in an easy way. All right. High blood pressure. So again, high blood pressure is one of the most prevalent chronic conditions in Canada. Over 50% of older adults have high blood pressure or hypertension. So when we see, trying to reach Canada's physical activity guidelines, both aerobic and resistance activities can help to reduce that blood pressure, which is fantastic. And what we see is that in the several hours after they exercise, we're seeing a decrease in that blood pressure. And so typically if someone has hypertension or high blood pressure, the recommendation is get active every day, because it only lasts a few hours and then your blood pressure might start to creep back up again, and then we want you to go again. So again, when they are speaking with their doctor, asking, okay, what makes sense in terms of blood pressure? Back when I worked in a cardiac rehab program, we did take blood pressure at the beginning and at the end of each class. So again, not recommending that you do anything outside of your scope, but if you're working with a specialized population, maybe it is a cardiac rehab program and you're not taking blood pressures, that's something that you can consider adding to the program. Arthritis. So over 40% of older adults actually have arthritis, whether it be in their knee or their back or shoulders, many joints, hands. And the real goal with physical activity for individuals with arthritis is to ease that pain and stiffness, which is, kind of a double-edged sword, because a lot of the times the reason individuals don't get active is because they feel too stiff, too pain. They feel too much pain. So a couple things that they can do, again, speaking to their doctor first, asking for recommendations, but let's say they're going to try to start a walking regimen. Maybe they want to apply heat to the knee to sort of loosen the area up, get it ready for the exercise. They go for their walk, and then afterwards they can apply cold to take down any swelling. But the more they move, the more mobility they're going to find they have. And once again, we want to get all of Canada's physical activity guidelines, because if you stop moving because you have arthritis, this is where we get those multiple chronic conditions. We stop moving because of arthritis, and then we develop, heart disease from that buildup of plaque over time. And then we get, diabetes because maybe we're not eating or exercising the way we're supposed to. So this is where all those core morbidities come into one another. And really, we just have to get active to not have this downward spiral happen. I always say chronic disease is not associated with aging. Chronic disease is associated with inactivity, okay? And last but not least there, aquatic exercise is really, really great for individuals with arthritis. I teach aquatic exercise myself. And so for individuals, you get that weightlessness. You get to go in the pool and you just feel completely weightless. And even the water gives that nice cooling sensation, a bit of actual massage while you're exercising. And that feels really, really great for people with arthritis. One thing I will note though when it comes to aquatic exercise is to ensure the individuals are supplementing with land exercise as well. Because then, I'm not going to talk about osteoporosis today, excuse me, but then we get into osteoporosis where we need to do weight-bearing land exercises to keep our bones strong. Excuse me. So not just aquatic exercise. And then stroke. So 50,000 new cases per year. And this is the third leading cause of death. And really 30% of individuals who have one stroke are likely to have another stroke. So in the early stages after a stroke, the important piece is to typically regain mobility. If someone has a hemiplegic side of their body, usually you'll see someone with a stroke, their shoulder will kind of start to sag. You'll see the side of the face, paralysis. So it's seeing, how much of that are we able to reverse? How much range of motion in the arm, for example, are we able to get back? And then it's important to get physically active because let's say the individual suffered a stroke because their blood pressure was through the roof, or maybe they had a buildup of plaque in the heart. Well, that's more of a heart attack, but so it becoming physically active, so the thing that caused your stroke in the first place doesn't cause you to have another one. So typically that first, right after the stroke, the individuals watching this are probably not working with those individuals. They're probably in the hospital setting. But for me, for example, when I worked in the chronic disease management program, we then got the outpatients who came from working in the hospital, and we would take them through a circuit. And in that circuit, the exercises we did with individuals with stroke were the same as I would do today with any older adult. We might just be focused on certain things, like for example, let's say we want to get them more strength in their hemiplegic sides. We're doing things like a shoulder raise. I know you can't see my whole arm right now, but you can see the shoulder and get the picture. So we would do shoulder raises in regular group fitness classes. They might just need to support with the opposite hand to help them lift that arm, for example, or doing range of motion, things like that. But individuals who have had a stroke, again, just with every other condition we've talked about, they just need to start where they're at, progress slowly, and you can of course help them to do that successfully. Again, talking to their doctor, may need to know about ranges of blood pressure, intensity that they are able to go based on their condition, but they can exercise safely as well in your classes and should be exercising. Next is type 2 diabetes. So about 18% of older adults have type 2 diabetes, and we see both short-term and long-term benefits when it comes to exercise. So in the short term, it's going to lower blood sugar levels. We're going to see that during and after the physical activity, and it can even last for up to 1 to 2 days. Now, this is really important about seeing their doctor, because their doctor is going to let them know, okay, based on the dose of insulin that you're prescribed and the medications you're taking, you should have your snack 15 minutes before your class, and then you should not exercise right after taking your insulin. So they're going to be able to recommend the safest way for them to get physically active. And then in the long term, we see an increase in the body sensitivity to insulin as well, and we can start to see things like people coming off medication because they're able to regulate their own blood sugar through the use of exercise. Now, it is really important that individuals who are new to exercise are checking their blood sugar levels before, during, and after physical activity, making sure we're not having any low blood sugar or hypoglycemia. Again, as I spoke about, if you start to see someone get a little bit pale and unusually sweaty, then you might want to just say, hey, Mary, you're feeling okay? And typically they will have, little candies with them or things that they can take in order to help bring that blood sugar back up. But again, with my experience with individuals with diabetes who have gone into hypoglycemia, they take that supplement and then they usually have a headache afterwards. So it's not a good experience. It's not something that they want to get in the habit of allowing to happen. So it is important that they work with their doctor to understand how they should be taking their medications, their insulin, and what schedule that they're going to exercise as a result. Parkinson's disease. This is another group that I've really enjoyed having the pleasure to work with. So with individuals with Parkinson's disease, really in the short term, we're looking that they improve their balance, coordination, endurance, and activities of daily living. Oftentimes with Parkinson's disease, it's trouble kind of getting things going. That's why you start to see individuals sort of get that shuffle happening when they walk, kind of that bent over posture. Some unfortunately lose that expression in their face as well. They have a hard time showing their emotions in their faces. I had a wonderful gentleman that I worked with, and you always knew that he was just beaming on the inside, but it didn't necessarily come out through his face. So when we're trying to keep individuals with Parkinson's disease active and healthy, it's a lot of times to do with balance because of that shuffle and that posture, because it's more likely that they could experience a fall. And then in the long term, after doing that physical activity, keeping their heart strong, keeping their muscle strong, keeping their balance, excuse me, we're going to see that decreased risk of falling, and then we're going to see a bit of a minimize of the impact of the symptoms of Parkinson's disease. And you'll see the picture that I've chosen. You see they're doing some boxing. There's some really cool Parkinson's initiatives out there. This one's a boxing program. There's some dance programs. So the great thing about Parkinson's is they might have trouble kind of getting started. Let's say they're going to do a sit to stand. They might have to rock back and forth to get to that sit to stand, but once they're into that movement, typically they can sustain it. So it's kind of that stop and go that's difficult for individuals with Parkinson's. But once you get them going, they're flying. And then I think this is my last but not least slide here, anxiety and mood disorders. So people with anxiety, we can see immediate and long-lasting effects in mood and overall feeling of confidence, of effectiveness. But support is really important. If you can imagine someone who is anxious and unsure, and they go into a new environment and a new class, that can be pretty scary. So support and ensuring that you set goals that are achievable and slowly progressing is so important with this population. And if you can, try to get people who are all on the same fitness level would be great, as well as using ambassadors. So using individuals who can welcome them to the program, make them feel comfortable, and make sure that they want to come back at the end of it. So to kind of wrap it all up here, like I said, it's interesting that even though all these chronic conditions are all very different, really the goal of many of them is to reach Canada's physical activity guidelines. The real goal or secret here is to make sure that they're talking to their doctor and they're ensuring that they're going to operate within safe ranges. So the goal, the benefit for everyone is to increase that cardiovascular health. As I mentioned, you have something like Parkinson's or arthritis and you stop moving, then you see that cardiovascular health go down. So we want to mitigate that. Decrease the risk of falls. We can help them control their weight. If you have a heart condition and you lose a few pounds, it becomes easier to move around. Possible reduced need for medication. Some people don't want to be on all these medications for all these different chronic conditions. So fitness, working with the doctor, can be a way to help them reduce or remove some of those medications. Helps to manage stress, improve sleep, increase energy and strength, and really all overall quality of life, which is really what it's all about. So I do encourage you, you probably are already working, if you're working with older adults, with individuals with chronic conditions, but please know, I've said this once, I've said it a million times, that older adults are not China dolls. To do a true service to them, we need to help them reach the appropriate intensities. So please feel more comfortable from today's webinar, knowing that, yeah, the research is showing us that no matter if you have cancer or heart failure or diabetes or arthritis, the research is all telling us that you need to get active. So thank you so much, everyone. If you have any questions, please don't hesitate to reach out. You can email me at emily@strongeryouSeniorFitness.com. If you're interested in learning more about the Stronger You Senior Fitness certification, feel free to head over to the website. And if you loved today's webinar, please share it on your social media channels. I would love that. And you can join me here again next week at the same time. And next week, we're going to talk about fitness and the role of fitness in the new COVID normal. Okay, so join me next week for that. Have a wonderful day, everyone. Thank you so much.